Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver Dussault, Dr. Harpreet Lote, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself.
Welcome back to the Beauty Equation. In the last episode, we talked about that unsettling feeling when your face doesn't quite line up with how you feel inside. And today we're going to talk about why. Because when women notice change and they go in to see the doctor or their professional, they are often given really vague answers like it's collagen loss, it's gravity, it's aging. But those explanations don't always match the experience. And aging isn't just one thing, and it doesn't happen evenly. So you have changes in structure, you have differences in your skin, hormones, fat pads, muscle tone, and they're all shifting at different speeds for different people. And when those changes show up on your face, it doesn't just feel physical, it feels emotional and it affects your identity. So today, we're going to explain what's actually changing clearly without any drama, not to create fear, but to replace confusion with understanding. So you can stop blaming yourself and start making better decisions.
I love that.
Yeah.
And I think one of the things that we can't escape is our genetics. So you come
That's
from
right.
parents, and that's going to have a significant impact on how you age, which parts of you show age first. And it's different for every person, but there are certain things that run in certain families. And we've touched on that in the past on our own
Yes.
experiences. But that's one thing that you can't change. So in terms of the things that we can't change that we'll see, I find from my experience that it's oftentimes those deeper changes, those deeper structures that you will really see, the ones where they're less affected by sun exposure. So where do you want to start?
Well, I want to start with that idea of genetics and that every person is different and unique. So, even in our teens, when we're pretty robust, pretty healthy, and, objectively young, we all have an Achilles heel, something that we've inherited that will speed up the how like that will age us faster than the rest. So you might have skin that's exceptionally sort of sensitive to UV and that tends to wrinkle in a certain way, and your friends might be able to tolerate more sun exposure than you, and genetically you can't. So for those people, skin interventions are going to be some of the first things they get into. Other people, their family structure might be such that they have smaller chins. So when we look at how human beings age, let's start with babies. They have little small chins, right? But then so do 90-year-olds. So it's like we grow this chin into adolescence and we get a nice jawline, and then it sort of regresses, right? And
Some of us get a nice jawline. Some of us has never had a nice jawline, and
that's
it
right.
gets less nice.
Yeah.
As
So
we
that's what I
age.
mean. So if you had a small one to begin with, right, you're going to age that lower part of your face faster. So that's something that's always interesting when we see our younger patients, to kind of go like, how can we, if they're somewhat interested, how can we change their aging trajectory or make it a little bit less stark, I guess.
Yeah, because for some who does have that smaller chin, we've talked in previous episode about bone resorption. So that shrinking of the bone that happens as you get older. It's a slow process that accelerates over time and becomes much more visible after menopause. But if you already don't have much bone there, your aging is going to show up in your lower face and your chin around your mouth much quicker. And there's nothing in your lifestyle, no amount of calcium and physical activity that you can do that will improve that. That's just one of those cards that you've been dealt.
Yeah.
What about asymmetry? I feel like facial asymmetry is an interesting thing. So some people are very bothered by the fact that they feel like like their lips, for example, like one side's fuller, one side's smaller. And then, when they go and actually see their photos that we do, they realize, oh, one cheek's bigger, one cheek's smaller, one eye's bigger, one eye's less,
Yeah,
more
for
closed. And then
sure.
they're like, oh my gosh. And it seems to like everybody has some amount of facial asymmetry. It would be weird if we were completely mirror images.
We would
Yeah.
actually look bad.
Yeah.
And it kind of alien. It's not normal.
Right?
If you if you haven't had the chance to Google that, Google symmetrical photos of they've done it for Brad
Celebrities.
Pitt and other stars that we deem very attractive people. I think there's one of Halle Berry as well. And when you see how they look so symmetrical, they look eerie. They don't look quite right.
Weird. Really weird.
Yeah.
And I feel like it's exacerbated once we get into mid-age because as we start to have more bone reabsorption and the fat pads shrink, then those asymmetries become even more noticeable. So sometimes
Yeah.
They do.
people will say, "Oh my God, all of a sudden I'm not even," when you're sort of like, "Show me a picture of when you were 20," and you can see it, but they had
It is
never
much more
seen it.
subtle. Yeah.
Yeah,
So
exactly.
asymmetries can become much more prominent. The hollow's more hollow, and I think that's where the fat pad shrinking makes a big difference too, because then you're seeing more of the bone, that you may not have seen before. One of the other
And then,
things that Oh, go ahead.
oh no, go ahead. That's an important.
Muscle laxity is something that we've touched on previously as well too. I don't think we talk about
Trying
it
to
that
do
much
face
today.
yoga?
Yeah, like we we'll talk about it like it's I don't know how many everyone's talking about weightlifting these days, and I know it's good for me, but I
Right.
just enjoy it, so I'm gonna stick to my Pilates. But your
Yeah.
muscles will get weaker with time.
Yes.
And with that, they won't work as well, and that applies to your face. We have so many muscles in our face that are responsible for facial expression, and
Yes.
some of them become much more lax and don't have the ability to lift as they used to.
And some
And
become really strong
That's
yeah,
as
right.
I
some of
flex the
them,
lower platysma bands,
yeah,
as ones that pull everything down get
They
intensely
do.
strong.
yeah. And that's something that can be quite genetic too. So, I think you and I have talked about Amanda, both our families having this. So in my family, a lot of the women, you'll have that like turkey neck. And
It's
I'm
like a
lucky the women
pelican.
in the women in my family are all quite petite. But in their photos, they'll look like they're overweight just because of that, like, muscle that is so strong, and I know Harpreet, I don't know how much you've been putting into my neck and how often we do it. It's just a very, very strong
It's
muscle.
just never enough, right?
It's never
No,
enough.
Seriously.
yeah.
I
That most muscles are strong.
but you
Pretty
don't want to
strong.
get too much in there and, then their head falls over.
Um,
Just
yeah,
kidding.
No,
yeah.
no. Yes, there's a dose. There's a proper
Mhm,
dose. But you're absolutely right. So all of the muscles that pull our face down seem to become stronger for
mhm,
various reasons.
mhm,
And then the muscles that tend to lift have a harder job of lifting our
mhm,
cheeks up, right? And there are some treatments that sort of zero in on that. M-Sculpt is one of them. They have M-Face for
mhm,
the face that sort of
mhm,
targets that. I think the data that's we're still understanding the role of that completely,
mhm,
but definitely muscle loss is a marker of aging for
mhm,
sure.
Then there's, thinking about photos, I when I was back in my day, when we didn't have a phone, when we didn't have a camera on us all the
At
time,
all times.
yeah, we weren't taking pictures daily and at every
Mhm,
event and of our food and all of these things, right?
Mhm.
And I think photos, lighting, it, it, it can really amplify the distress, you
mhm.
know, like heaven forbid my front camera turns on when we've all had that happen where
Yeah.
you get that angle where you're thinking, oh my God,
Yeah.
I look like Jabba the
Even
Hutt.
yeah. I mean, even the availability of reflective surfaces, right? Like
Mhm,
mirrors, right? They weren't that common 50, 70 years ago. Think about that, right? We just didn't see ourselves as often, but now through Zoom or through, photos or whatever, we just see ourselves all the time.
I actually had a gal
So,
in consult this week say that she was gonna just drape all the mirrors in her house. She's like, maybe that's what I need to do. Like, just put scarves over all of the mirrors. I'm like, oh, it's an option.
yeah, yeah, I don't know, but you know what? It's aging is just I don't know how to say this, but it's a continuous thing, right? It's going to
Mhm.
move on. Time moves on. We can't stop that
Yeah.
completely. And Catherine O'Hara and that what was that show that she was in?
Schitt's
Schitt's
Creek?
Creek?
Schitt's Creek, right? Do you remember that time where
Oh
she
my
was like,
gosh.
take lots of
Yeah.
photos of yourself when
Naked
you're
photos of
20,
yourself when you're
right?
Naked
20.
It's
photos when you're
true.
young. Yeah.
True. I mean, at every age, I should take photos of
Mhm.
myself now because when I'm 80, right?
Mhm.
So I think we do kind of have to learn to appreciate where we're at
Totally.
and
Yeah.
appreciate what we do have.
Yeah.
And at the same time, like today's episode is really about understanding, right? Because we don't know why we see these changes, but we still have lots of good stuff, right? Got to
Yeah.
remember that. Yeah.
There's a few people actually, there's someone who works in our clinic who, for her aging journey, her big thing has been she's very slim and always feels like she's looking m gaunt. And the other
Hmm.
day, she's like, "I feel like I look like a cancer patient," and she's not sick. She's just the
Oh,
way she is.
no.
She's really, really active. And some people, that can happen. So she's someone who has these, like, beautiful cheekbones,
Right.
but below her cheekbones doesn't have much fat. So, like, 20s and 30s, everyone's envy. Then you get into the 40s, that fat that's
Gosh,
underneath
yeah.
your cheekbone just keeps going and going, and that
Yeah.
hollowness made her look ill. And we did a treatment on her recently. And when she looked
Hmm.
and started crying, she's like, I don't look sick anymore. And
Oh, that's
which was
lovely.
lovely. And
Yeah.
it's that's very individual. Whereas other people, they have a lot of fullness in their cheeks, and that would never
Yeah.
happen to them.
Yeah.
Yeah, exactly.
Right.
Amanda.
I'm like,
So
oh, cry
everyone
me a
is
river. Don't
different.
have
And
any
so, like,
fullness here.
yeah, you've lost some volume in your cheeks below your cheekbone, but the way your bone sits and your fat pads sit, you don't have that sickly
Yeah.
appearance that
Yeah.
No,
as
I
you
just
age.
get nice jowls thanks to my genetic profile. And it's yeah, I don't know. It it definitely hits at identity for
Yeah, for
me.
sure.
Um I start to see more of my grandmother in my face,
Mm,
which I loved my grandmother. She raised me, but I don't know that I'm ready to look quite like that.
yeah,
And then I think, oh, I'm just being vain. But it definitely can be jarring
For sure.
when it
For
starts
sure.
to happen, but it kind of happens to all of us.
Yeah.
it
So we
does.
talked a little bit about like genetic sort of predispositions, but let's talk about something that's universal. I'm going to just kind of go over for people, our listeners, like what does happen holistically to your face.
Mhm.
And for one person it's going to be the skin is going to be a weak spot. For another it's going to be those neck depressors. For another it's going to be a weak chin. For another it might be that they're not very robust in the face or have fat in their face to start with. But globally, this is what happens. You start to lose collagen in your skin, right? So in your 20s, you're going to lose about 1% per year, and it just keeps going. So that elasticity and snapback starts to decline. And then, depending on your lifestyle, too, you're going to have dyspigmentation or sort of dullness of the skin start to show up. And UV damage can also show up as enlarging the pores and then a spotchiness to the skin, and you can also start to develop some crepiness as well. So those things start to happen, and then in your 40s, sort of late 30s, you start to see some fat resorption. So a lot of people in their 20s will have chubby cheeks and not like that sort of adolescent look. By their 30s and sort of mid 40s, they have a more sculpted look. And I would say women look really good in their early 40s, many of them, right? They're like, they look good. They're holding their own. So, but they've got a bit of a sculpted look. And then the fat pads start to resorb beyond what looks good, and you start to get hollowing underneath the eyes. You might get some hollowing in the temples, especially our runners. We start to see that. They tend to lose fat, interestingly, in their temples.
Just another reason not to run.
Yeah. And that sort of up and down bouncing, repetitive sort of pulling on the skin is not good for it either. So I'll put that out there.
But if it's good for your headspace, you can keep doing it.
Yes, absolutely.
We'll give you some tools
please
to reverse the running, the positive effects of the running, the negative.
Yeah, no shame to runners out there. I'm just not going to do it.
110%,
but I think you're awesome.
Yeah.
And go.
Yeah. So you start to see that volume loss. Then you start to see changes periorally, right? So you get these textural changes around your upper lip where you get lip lines starting. The lips start to get slimmer and slimmer. The chin starts to resorb and the mid face starts to sort of fall into the face. Right. So that's what we start to see. Then when you marry that with that continuing collagen loss, you start to see more jowling and sort of hanging of the skin sort of below the jawline. So that is sort of encapsulates what people can expect to experience. Of course, we have tools, and depending on your genetics, 1 or 2 or 3 of those things is going to be something that ages you a little bit more quickly. And it's going to be the thing that we might target first to keep you looking like yourself. So
that was a really good recap. Yeah.
Thanks.
And then just to finish, as your bone shrinks, your skin doesn't. So you're going to get those folds and that sagginess.
Totally.
And you're so right in saying what we target first will depend on your genetics and your anatomy. Because oftentimes we can get a sense of what's going to start to show up first, and that the order in which we discuss treatments
100%.
may change on the person.
And I would add to that what bothers the person the most.
Yes.
Yeah. I had one recently and we didn't end up doing any treatment, but this person came in with the expectation of getting a Botox treatment. But when she went through, it really bothered her. And we looked at photos. She actually didn't need any Botox. She's someone who had a lot of volume loss in her big mid-face, hollowness, and was concerned about, just tired eyes and a bit of heaviness between kind of the sides of the nose and the corners of the mouth. And she had some expressive lines, but not really any lines at rest. And it was really more volume depletion. And I could see as we were talking, she was quite disappointed because she in her head thought, well, the Botox is going to fix the issue here. And, with understanding, she realized that wasn't the treatment for her. And oftentimes when those treatment expectations aren't met with what they were hoping, it can take some time to understand what we discussed, and we ended up deciding that we would check in a couple weeks and just see if there was more information she wanted, because it can be overwhelming to take it all in. Like you described it so well there, Harpreet, but it's a lot when you're not doing this every day to wrap your head around it all.
Yes, but when you understand the difference between surface changes and structural ones, between perception and reality, it becomes much easier to make decisions that actually serve you. So I think if these conversations are helping you see things differently, we'd love for you to subscribe.
Yeah. I hope you enjoyed today's episode. It was really about helping you gain a bit of clarity as to what happens and realizing that this process is going to happen, but we have tools to slow it down, even when we know that there are certain periods in your life where that might speed up. And our next episode, we're going to talk about the different approaches that we have and how, we can make these decisions and make treatment plans without any urgency, without any pressure, so that you are happy with the outcome and you don't have regret from your treatment options. And really, it's something that will sometimes require more than one conversation, and that is okay.
Yes. Until next time. Bye
Take
for
care.
now.
Bye-bye.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on the Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at HLotte MD, and at Crow's Feet in Confidence. Until next time, keep questioning the equation.